Foot Reflexology. Welcome to this NCBTMB approved online distance learning class. I will be presenting today, and my name is Denise Cagini. I'm a licensed massage therapist in 4 states and the state certified in California and nationally certified in massage and bodywork since 2001. I have 20 years experience in therapeutic massage and bodywork and 15 years experience as a massage therapy instructor in the states of California and Missouri. In addition, I'm a naturopath with 15 years experience at a wellness center in Missouri. Currently, my passion is teaching, having a private practice called Transformation Through Touch, and working in the spa industry. How this online class works. You can take as long as you like watching this online distant learning class on reflexology. When you are finished watching, send me an email at cagini.d@gmail.com if you have not received your final exam. When you have completed your final exam, email it back to me at cagini.d@gmail.com. I'll grade the exam, and when you pass with a grade of 70% or more, you will receive your e-certificate of achievement for this NCBTMB approved online foot reflexology distance learning class. If you have any questions, feel free to email me and I'll get back to you as soon as possible. So now sit back and relax and let's begin. A quote, "The whole reflects every part and every part reflects the whole." What is foot reflexology? The dictionary definition of a reflex is an involuntary or instinctive movement in response to a stimulus, or in the sense of reflection or mirror image. The reflexes on our feet and hands acts as a mirror image of the body. Reflexology works with the central nervous system, and it builds on the research done in the 1890s by Sir Henry Head and Sir Charles Sherrington, who began to show through their research that there was a neurological relationship that exists between the skin and the internal organs, and that the whole nervous system adjusts to a stimulus. According to this theory, the reflexologist's application of pressure to the feet, hands, face, or ears sends a calming message to the peripheral nerves in these extremities to the central nervous system, which in turn signals the body to adjust the tension level. This enhances overall relaxation, bringing internal organs and their systems into a state of optimal functioning, increases blood supply, which brings additional oxygen and nutrients to cells, and enhances waste removal. It positively affects the circulatory, respiratory, endocrine, immune, elimination, and neuropeptide systems in the body. The best way to start is to know the history of reflexology. Modern reflexology is based on an ancient form of therapy, and there's evidence that some form of foot and hand therapy being practiced in China as long ago as 4000 BC, and also at the same time in Egypt, as depicted on many of the tombs. The North American tribe of Indians are known to have practiced a form of foot reflexology for hundreds of years, and zone therapy was used as far back as 1500 AD. During the 16th century, a number of books were published on zone therapy, and the rediscovery of some form of systemized foot treatment was accredited to Dr. William Fitzgerald, who called it zone therapy, and drew it to the attention of the medical world between 1915 and 1970. The American president, James Abram Garfield, was said to apply pressure to his feet to relieve pain. So from 1915 to the early 1930s, the subject of zone therapy met with a certain amount of success with osteopaths and dentists. When Dr. Fitzgerald returned to the United States, he became the head of the Nose and Throat Department at St. Francis Hospital in Hartford, Connecticut. Around 1909, Dr. Fitzgerald discovered or rediscovered zone therapy. Almost 10 years later, he wrote his book about how he stumbled upon this concept of zone therapy. The physiotherapist working with Dr. Rowley at St. Petersburg was Eunice Ingham. Eunice Ingham extended the work of Dr. Fitzgerald and painstakingly mapped the feet with all the corresponding organs and glands of the body. She lectured at the medical clinic headed by Dr. Charles Epstein in 1939. In his report, he acknowledged that reflexology worked. However, while they knew it worked, doctors were not interested in using it because reflexology was too time-consuming and they couldn't make as much money with it. Eunice Ingham is still known as the pioneer of modern reflexology. In addition to her writings and lecturing, she, along with her nephew Dwight Byers, founded the International Institute so that her work could be continued in perpetuity. Eunice Ingham died in 1974, having devoted 40 years of her life toward reflexology. The practice of reflexology. The theory behind reflexology is that these areas correspond to organs and systems of the body. Pressure applied to these areas affect the organs and benefits the person's health. Reflexologists used foot charts to guide them as they apply pressure to specific areas. Practitioners of reflexology include chiropractors, physical therapists, Chinate Sun practitioners, and massage therapists, to name a few. Several studies funded by the National Cancer Institute, the National Institutes of Health, and the Mayo Clinic indicate that reflexology may reduce pain and psychological symptoms such as anxiety and depression, and enhance relaxation and sleep. Studies also show that reflexology may have benefits in care with people with cancer. Reflexology is a science that deals with the principle that there are reflex areas in the hands and feet which correspond to all glands, organs, and parts of the body. By stimulating these reflexes properly, you can help many health problems in a natural, non-invasive way. Reflexology helps maintain the body's homeostasis, an inner balance that is essential for the body to function properly and effectively. When your stress levels are above what they should be, your homeostasis is thrown off, causing you not to sleep, to overeat, to gain or lose excessive weight. Over time, these factors can lead to heart disease, stroke, high blood pressure, diabetes, autoimmune disorders, and many other problems and disorders of the body that are common today. Dr. Fitzgerald identified 10 zones which follow parallel lines vertically through the body. Hence, a reflex in the zone of a specific finger or toe would affect any organ or tissue group within that zone, from the toe all the way to the brain. This was the system taught by Eunice Ingham. Eunice Ingham extended the work of Dr. Fitzgerald and painstakingly mapped the feet and all the corresponding organs and glands of the body. Reflexology is sometimes referred to as acupressure or zone therapy. Zone therapy is the accurate term. Acupressure is not correct, as this term refers to stimulating various acupuncture meridians using pressure over acupuncture points. However, one does not need to know acupuncture to do foot reflexology effectively, and in fact, it is not about acupuncture meridians. It's about another system of channels that carry subtle energy in our bodies. For this reason, the correct term for this therapy is actually zone or channel therapy. Zones are considered to be some guidelines or markers linking one part of the body to another. There are 10 equal vertical zones running throughout the length of our body, from the top of our toes all the way to our body. On the soles, on each toe will be part of one particular zone, and it should be noted that a zone is not a surface marking. In fact, it runs through the body much like an arrow piecing from the front and emerging from the back. Reflexology zones connect all the organs and glands in the body and culminate in the feet and hands. By applying pressure with the fingers or a blunt object with approximately 10 to 15 pounds of force pressure, you may send a surge of energy to the corresponding area. Pressure may be applied for as long or with as much force as is comfortable, not to exceed between 10 and 15 pounds of pressure. In reflexology, every organ, valve, muscle, etc., that lies within a zone can be accessed via a point or area on the feet or hands. For example, working between toe number 2 and toe number 3, or finger number 2 or finger number 3, the eye point is found. These pathways between pressure points and other parts of the body are thought to be connected via the nervous system. Zones are similar to, but are not the same as meridians, which is found in Chinese medicine. However, there are some correlation with some meridians and the location of organs on the feet and ankles. There are also horizontal zones divided the areas of your feet into these zones that correspond to your head and neck, your chest, the abdomen, and your pelvis area. Zone 1, on the sides of the feet, you will find 2 prominent bones. On the sole, you can find a transverse line passing through the tips of these prominent bones. This line is the shoulder line. The area of the foot from toe tips to this shoulder line comprises horizontal zone 1 and contains reflex points for the organs of the head and neck. Zone 2, at the sole of the foot, contains 2 mountain-like structures, and they're called the balls of the foot. These balls are of a much darker color as compared to the middle of the sole. If you draw a line passing through the lower borders of the balls of your feet, you can find the diaphragm line. The diaphragm is a dome-shaped muscle that separates the chest from the abdomen. The area of the foot between the shoulder line and the diaphragm line comprises horizontal zone 2 and contains points for organs of the chest. Zone 3, there's another prominent bone that would be the middle or outer border of the foot. If you draw another transverse line passing through this prominent bone, you will find the navel or waistline. In anatomical terminology, this line represents the 4th lumbar vertebrae, or L4. The area of the foot between the diaphragm and the navel lines comprises of horizontal zone 3 and contains reflex points for most organs of the abdomen. And finally, in zone 4, when you observe the sole of the heel, you will find an oblong dark area. This is the area of the foot between the navel line and the junction of the two colors of the skin. This is the junction of light-colored skin of the midsole and the darker colored skin of the heel, and comprises horizontal zone 4, which contains reflex points to the organs of the lower abdomen and pelvis. The organs that lie near the entire front surface of the body can be easily reached. This goes through the reflex points on the upper surfaces of the 2 feet, whereas the organs that lie nearer the entire back surface of the body can be more easily reached through the reflex points on the soles of your feet. With the help of these 4 horizontal reflexology zones and 10 vertical zones, 5 on each foot, you can determine the reflex area of any organ in your body. The reflex channels or zones are a system of tiny tubes or energy channels that run vertically down the front of the body and up the back of the body along the entire length of the body. They form what are called reflex channels that connect to all organs, glands, and tissues of the human body. Thousands of these ultra-microscopic channels run the entire length of the body according to the theory of reflexology channels and zones. Interestingly, each part of your foot and hand, top, bottom, and sides, corresponds or connects to a particular organ, gland, tissue, or muscle area of the body. For example, the large toe and all of the toes to some degree correspond or reflex to the head. The arch of the foot reflects or corresponds to the spine. The middle of the foot corresponds to the trunk and internal organs. As you rub various areas of the feet or hands, sometimes you can feel bits of hard sand-like crystals. This is a kind of sediment created from uric acid that builds up in the channels. When it is removed by rubbing properly, the channel opens or empties and energy flows to the organs or gland that the channel was connected to. It's a very complex system, but simple to work with. General reactions. In reflex zone theory, general reactions are subdivided into immediate, intermediate, and late reactions, which gives a great experience to the client after the reflexology treatment. I will explain each reaction separately. Immediate reaction. When a client is undergoing a reflexology session, they will feel the experience of well-being immediately after the session. The client can feel a pleasant warmth and relaxation experience during the session time. If the session is too vigorous, the client might be experiencing pain, which is a different issue. But when the treatment is going smoothly, the client will release his or her tension and soon falls into sleep. Sometimes the client wakes up in a short time and is much fully refreshed. These types of reactions are called immediate reactions and are one of the first reflex zone therapy general reactions. Intermediate reactions. If the client is not experiencing the immediate reaction, you might observe intermediate reactions in his or her body after 2 or 3 days after the session. These reactions encounter one or more of the following below, such as an increase in urinary output, an increase in the bulk and sometimes frequency of the stool, occasionally a feeling of mild pain and general malaise in the body with or without a fever, an increase in the activity of the skin with increased perspiration, which is sometimes smelly, an increase in the secretions from the mucous membranes of the nose, pharynx, and bronchi, signifying a cleansing process. These are merely signs of the reactivation of the body's defense forces that are trying to eliminate toxins and waste material accumulated in the body. These unpleasant reactions are purely temporary and do not permanently harm and therefore should cause no alarm. With the body progressively getting free of toxins, the above-mentioned reactions rapidly diminish in intensity and ultimately disappear. These reactions do not necessarily affect each and every person. Many people straight away exhibit only late or delayed reactions, which I'll talk about next. Late or delayed reactions. These commence after the body has been rendered reasonably free of toxins. These comprise a restoration of homeostasis, which is a return of bodily function like temperature, blood pressure, respiratory rate, heart rate, acid-alkaline balance, etc., towards a state of normalcy or balance. And the increase in the body's immune system, marked by a rise in the number of white blood corpuscles and of gamma globulin. With its toxins eliminated and your immunity strengthened, the body is able to drive away illness and disease. What should one expect on a visit to a practitioner of reflexology during a session? A typical foot reflexology session runs from anywhere from 30 to 60 minutes. Shoes and socks are removed and the client is made comfortable, usually by sitting or reclining. Some reflexologists offer a foot bath at the beginning of the session. Usually no lotion, creams, or oils are used. A reflexologist will begin a foot reflexology session by undertaking a thorough health, diet, and lifestyle consultation. Following this, they will examine your feet and may ask further questions. The session will then begin with some general relaxation techniques, followed by a precise thumb and finger walking technique aimed at applying pressure to every reflex area on the top and bottom of the foot. Pressure is applied in thumb and finger walking patterns, resulting in gentle stretching and massaging of specific zones of the feet that correspond to body organs. Foot reflexology is by far the most popular form of reflexology. On each foot, there are over 7,000 nerve endings called reflexes that correspond to every organ and system within the body. By pressing on these reflex points, you stimulate the nervous system and open energy pathways that may be blocked or congested. A reflexologist will always work on both feet as part of a full session. The left foot represents the left side of the body, and the right foot represents the right side of the body. Reflexology is not ticklish, as a firm pressure is used. If a particular part of the body is out of balance, the corresponding reflex may feel tender or sore during the session. It's important that the client lets the practitioner know so that steps may be taken to rectify this discomfort. Generally, people describe any areas of tenderness as sweet pain, which is both bearable and beneficial. Research has shown that reflexology has 4 primary benefits. 1, It can impact specific organs, such as by increasing blood flow to the kidneys. It can bring about the reduction of specific symptoms by helping organs function properly. It can create a relaxation effect and reduce anxiety. And it can relieve pain throughout the body. Next, we'll take a look at the location of the major reflexes on the foot. The heart. Its location is on the ball of the foot. The thyroid, located under the big toe. The solar plexus, located off to the side below the middle of the bottom of the foot. The stomach, located on the large area below the ball of the left foot, and it's a smaller area on the right foot. The pancreas, located under the stomach, under the ball of the foot. The spleen, outside and midway down the foot. The liver, located under the ball of the foot, under the heart and lungs. It's a smaller area on the left foot than on the right foot. Kidney. These are located along the middle of the bottom of the foot, from the middle toe to the middle of the heel of the hand or the foot. The adrenal, on the diagonal above the kidneys. The bladder. It's located to the inside of each foot, closer to the heel. The sciatic nerve. It's located in the center of the heel of each foot. Thumb walk from the right to the left over this area. Go all the way up either side of the heel. Thumb walk the back of the heel. The small intestine and large intestine. These are located along the middle of the bottom of the foot, from the middle toes to the middle of the heel of the foot. The large intestine is shown in the diagram on the top, and the small intestine is underneath that. The uterus, prostate, and the ovary and testes, located below the ankle on the sides of the foot. Foot reflexology techniques. These movements are used to loosen up and relax the foot, releasing tension to allow deeper work and to provide a sense of well-being by facilitating energy flow. You have the side-to-side, the metatarsal kneading, spinal twist, ankle loosening, ankle rotation, ankle stretch under and over, toe rotation, diaphragm deep breathing, and diaphragm solar plexus tension relaxer. I'm going to go over each one separately. Side to side. You place your hands on both sides of the foot, and you rapidly move the hands back and forth in opposite motion to each other. This creates a rocking motion. The hands are relaxed with the fingers loose so they lightly slap the top of the foot. The metatarsal kneading. This technique is also known as the lung press. You make a loose fist and using the right hand for the left foot, place the fist on the bottom of the lung reflex area, knuckles up toward the toes. The other hand grasps the top surface of the foot, covering the lung reflex. Press the fist against the foot, moving it back far enough to stretch the calf muscles. As pressure is released from the fist, squeeze with the other hand as the foot is allowed to come forward. Repeat several times on each foot. The spinal twist. You want to place hands side by side along the arch of the foot with thumbs next to each other. Starting at the lower spine reflex area, keep the hands closest to the heel stationary while making a ringing motion back and forth with the hand closest to the toes. Concentrate on twisting the joints rather than sliding over the skin. Gradually move up the foot, keeping one hand stationary while the other twists, until the index finger of the twisting hand reaches the cervical spine reflex area of the foot. Ankle loosening. The base of both palms are above the sides of the heel. The palms cover the ankle bones. Use the side-to-side motion technique, alternating straight back and forth, allowing the ankle joint to serve as a pivot. Use rapid, very relaxed movement, keeping the palms securely over the ankle bones. The ankle rotation. You want to support the heel in the palm of the hand, with the other hand grip the side of the foot as shown. Rotate the foot 4 to 5 times in each direction, as in a full circle as is comfortable, maintaining constant pressure. Use the heel as the pivot point. Toe rotation. Place the fingers of one hand on the side of the foot with the thumb on the lower surface of the toes. Beginning at the base of the big toe, pull up slightly and rotate the toe in a full circle in both directions several times. Release the pressure and move on to the next toe. Fingers can also be placed alongside each toe as the toe is jostled back and forth with a relaxing effect. Diaphragm deep breathing release. You place the ball of the thumb in the center of the diaphragm's solar plexus reflex, allowing the fingers to rest on top of the foot. The client takes a deep breath in as the thumb is positioned. The client exhales as the top of the foot is pulled into the thumb, similar to the diaphragm relaxer. Do this 2 to 3 times on each foot. The diaphragm's solar plexus relaxer. The entire diaphragm area will be worked by starting at the inside edge of the foot below the metatarsals. Place the working thumb on the reflex with a slight angle up under the metatarsals. With the holding hand, grasp the toes, lift slightly, and reflex the foot forward and down, pulling the foot onto the thumb. Then move the thumb toward the outside edge of the foot and repeat continuously until the outside edge of the reflex is reached. Change hands and work toward the inside edge. Common ailments will be covered for foot reflexology next. To relieve tension in the neck and head. You relieve neck tension by applying pressure to the joints or necks of your small toes. If you are experiencing tension in one area of your neck, you will feel tension or a slight discomfort in one of your corresponding toes. Your entire head is represented in your two big toes, so apply pressure to them to relieve headache tension. Use your fingers to apply steady, firm pressure to the back of your toes one at a time, and continue until you feel the tension in your neck begin to dissolve and the pressure leave your head. Digestive issues. Digestive issues are the most common issues treated with reflexology. The reflexology point is the sole of the foot, also known as the solar plexus region, the nerve center of the body that can help relieve your stomach stress. Press on this point. For back pain, sit straight and hold your feet. Take the right foot into your hands. Find the bone that joins the big toe and the second toe. Place your thumb in this area and put pressure on it. Press for 1 minute. Keep inhaling and exhaling. Decrease the pressure and rub the area. Repeat the same on the other foot. For general aches and pains, treat all the reflex points on each foot to evaluate all your areas of imbalance. Once you've worked on each of your feet, return to any painful points and work your sore points gently until you no longer feel the soreness or discomfort. For diabetes, reflexology for diabetes is a very effective treatment, and it helps to control blood sugar levels. The other uses also are better functioning of the kidney, improvement in blood flow, relaxing the body from stress and the day's fatigue, reduction of pain in the joints, kidney stones, chest pain, etc., and controlling blood sugar levels. Diabetes is one of the diseases that can be controlled using methods of reflexology. It's a life-threatening disease, and some people diagnosed with this condition should take care of themselves. Diabetes is caused due to the improper glucose or carbohydrate metabolism. Minor defects in the intestine, pancreas, liver, stomach, or muscle cells can cause this as well. Controlling the sugar intake is one of the main techniques to control diabetes. However, there are different types of diabetes which need different kinds of medication. Type 1 diabetes, this type, the pancreas does not produce enough insulin to the body. This is known as insulin-dependent diabetes, and the person diagnosed with it needs injections to control the sugar levels in their blood. Type 2. In this type of diabetes, the cells develop a resistance to insulin and do not absorb the sugars found outside the blood. There's gestational diabetes. This is pregnancy-related diabetes. It occurs when the pancreas does not produce extra insulin while pregnant. The reflexology for diabetes is proved to be really effective. Diabetes, according to reflexology, can control with the proper use of reflex points. Some reflex points found in the feet can stimulate and balance the functioning of the whole body. In the course of time, the body can be restored. It helps to remove the toxins and encourages healing. If pressure is applied in the right manner on these points, it will act to aid in diabetes. Feet pressure points target the liver. This is the best point for the treatment of insomnia, diabetes, and hypertension. Regularly pressing and massaging this point will help reduce some of the symptoms of diabetes. Foot reflexology for diabetes is practiced to control the blood glucose levels. The big toe point. Apply pressure under the big toe with the help of your fingers. Since it's hard for you to do this alone, you can ask a friend to help, or your reflexologist will do this for you. The pressure points under the big toe will help in giving a long-term relief from diabetes. Regularly pressing this point will prove to be fruitful, as it worked for many other diabetic clients. For any type of knee pain, the knee reflex point. This point will help to strengthen your knee joint and heal any injuries in this area. This reflex point is found 1 inch below the ankle bone and is located in a soft, small, triangular section. Place your thumb on this point and move it up and down with some pressure. Make sure that you massage the point that feels sore and hard for 5 minutes. You will feel relaxed and pain-free after regular use. For headaches. People get headaches due to neck tension. Increased circulation to your neck can effectively relieve headaches. The reflexology point, the big toe on the right and left foot, which are connected to the head and neck areas. What do? There are generally two techniques you can use for headaches. If you feel a headache coming on, make small circles with your thumbs on your big toes. If you already have a headache, wet a paper towel or cloth with very warm water, wring it out, and snake it between your toes like you're getting a pedicure. Make a seesaw motion to stimulate the nerves between the toes and activate the reflexes for your head and neck. Stimulate the big toe for 30 seconds, 2 to 3 times a day. For PMS, skip the ibuprofen. New research shows reflexology decreases intensity and duration of menstrual pain. The reflexology points are the inner and outer reflex areas on each side of your ankle. These are the reflex areas or the hot spots of the body, the uterus and vagina for women. Stimulating these areas can improve the circulation to the reproductive organs and help to regulate and balance you during that time of the month. Use your thumb and press. Try this exercise for 10 to 15 seconds. Take your thumb off, rub the area gently, and repeat for another 10 to 15 seconds. Do this 2 or 3 times a day during your period. Next, we'll take a look at some of the contraindications for foot reflexology. While reflexology is an extremely safe healing practice, it's important to be aware of a few contraindications or times when reflexology might not be a wise choice. These contraindications include the following. Reflexology on the foot is discouraged in clients with foot fractures, unhealed wounds, or active gout in the foot. Clients with osteoarthritis that impacts the foot or ankle, or those with vascular disease of the legs or feet should consult with their primary care provider before beginning a reflexology on the feet. An acceptable alternative would be to use reflexology on the hands, face, or ears. The next, clients who report current thrombosis or embolism, which is an obstruction of the pulmonary artery or branch of it by a free-floating blood clot or embolus, should not receive reflexology therapy. Since reflexology improves circulation, it could potentially cause a clot to move toward the heart or brain. Next, for women in early pregnancy, the first 6 weeks, the reflexology session is altered by treating the uterine and ovarian reflex point more gently or by avoiding them altogether. In general, caution should be exercised during pregnancy because of reports that stimulation can cause contractions. Next, babies and young children will receive benefit from many techniques but rarely have the patience for the whole session. Thus, sessions are abbreviated in length. In general, practitioners will stay away from open wounds and may choose to wear plastic gloves or not treat areas that are compromised. Obviously, open sores to the hands or feet would be reason to avoid reflexology. Acute injuries must also be handled with care. Burns, wounds, and infections to the hands and feet should be also limited use or not use reflexology at all. Lower extremity swelling or chronic skin changes that are a result of vascular problems to the feet should also limit this form of therapy. Also, the removal of a cancerous tumor or other surgical procedures such as a wart removal also make reflexology inadvisable. I will resume after a break. We're almost halfway through the class on reflexology. After the break, I will discuss hand reflexology, ear reflexology, and face reflexology. Other benefits, other modalities complementary to reflexology, and self-care. Welcome back. We'll talk about hand reflexology next. Hand reflexology is equally as effective as foot reflexology. There are reflex points on the hands that correspond to every organ, gland, and part of the body, and by using the unique thumb and finger techniques on these reflexes, the body responds by relaxing, rebalancing, and improving blood circulation. The hands are not as sensitive as the feet, and the reflex points are much deeper. However, a hand reflexology treatment can be extremely beneficial. Hand reflexology can be used at the start or the end of a traditional foot reflexology session, or as a standalone session in its own right. It is particularly useful to use when there is a foot injury or where a client is unable to elevate their leg. It may also be used for self-care and is often demonstrated by practitioners to enable the client to use reflexology techniques in between appointments. Hand reflexology uses completely different techniques to foot reflexology, and some the same. Mainly because the hands are very flexible and the reflexes are much deeper under the skin, means you need to reach deeper and hold for longer to stimulate a hand reflexology point. The best way to position yourself and the person that's set to receive reflexology is to sit across a table from them with a towel under their hands or wrist for comfort. Every reflexology treatment begins with a relaxation exercise. The relaxation exercise sets the tone of the treatment as relaxing and helps to soothe the muscles before you get into a therapeutic, deeper reflex points work. Locating the major reflex points on your hands. As you can see in the picture, that's the map, the hand reflexology chart. The reflex points on your right hand corresponds to the right side of your body and vice versa. The thumb represents your head. The inside of your upper thumb corresponds to the side of your head. The tips of the thumb, pointer finger, and middle finger relate directly to your brain. Working with the area between your fingernails and first thumb knuckle will help you to relieve sinus pain or pressure. Working on the pinkies will de-stress shoulders. The area beneath the fingers that extends to the thumb will stimulate the lungs, the heart, the stomach, and pancreas. The area from the base of the thumb to the wrist will bring relief to the intestines, spleen, and kidneys. The area below the index finger, middle, and ring fingers access lungs and heart. Just below the lung and heart area is the point for the stomach and intestines. And focusing on the wrist area will access reproductive organs. Common problems and techniques to alleviate them. One large benefit of hand reflexology is that the hands are easily accessible and therefore you can easily administer self-care. You can view a hand reflexology chart and compare your hand to the areas. There are reflex points on the palms as well as the tops and backs of the hand. Many of the reflex points on the top of your hands mirror the points on the palms of the hand. However, it may be more difficult to access these points due to the bones in the top of your hands. Next, we'll take a look at some common health issues and the techniques we can use to alleviate them. Digestive issues. Digestive issues, you can help regulate and support digestion and stimulate the intestine reflex. You can interlock fingers to stretch out the hand. You can roll a ball around the lower area of the palm or heels of the hand and do this for a minute once or twice a week to help with digestion. Insomnia. You want to stimulate the pituitary gland reflex. Find the middle of your client's thumbprint. Using the side of your thumb, press it into the center of the thumb and hold for 45 seconds. Perform on both thumbs 2 to 3 times a day. Cold and flu. You'd want to focus on the head and sinus reflexes. Press and rub from the base of each finger to the tip. Fingers are the reflexes for head and sinuses. The fingers might feel tight and puffy if you're congested. You want to perform on the fingers 3 to 4 times a day. For back pain, you want to stimulate the spine reflex. The side of the thumb all the way down to the wrist is the spine reflex. Press with the flat of opposite thumb, starting at the top of the thumb down to the wrist. This might feel tender if suffering from back pain. If certain spots are tender, spend more time on those tender areas, but you do not need to apply a lot of pressure if it's painful. Repeat on both hands several times, 3 to 4 times a day. Low libido. You want to stimulate the ovaries and uterus, prostate, and testicles. Grasp your wrist with thumb and forefinger forming a circle. Twist the opposite hand. Twist your wrist about 20 times and then perform on the opposite wrist. Repeat 2 to 3 times a day. For the neck and back pain, when you are stressed, tension can build up in your neck and shoulders. A quick hand reflexology session can bring relief, especially for those working on computers. Creep forward along the spinal reflex, the point which runs from the middle of your wrist to the top of your thumb. Creep up and down this area twice, working around the base of the thumb to contact the neck. Headache. This point is found between the thumb and index finger. This point is effective to work with your client as well as for self-care. For shoulder pain, to soothe your shoulders, creep along your little finger from the bottom to the top. This should help relieve your shoulder pain. A hand reflexology routine. How to reach the hand reflexes. Using one finger or thumb, apply firm pressure in on a spot on the hand. Without lifting the thumb or finger, rotate the thumb or finger so the pressure is being applied in a circular motion. Do this over the same spot for about 3 to 5 seconds. Move the finger or thumb to a new spot next to where you've been working and repeat again for about 3 to 5 seconds. Begin every hand reflexology session on the right hand. Do the whole hand and then follow it with the left hand. A hand reflexology relaxation exercise. In this one, you can use a little cream or massage oil and gently rub around the wrist of the right hand. Use wide, gentle, outward sweeping motion of the thumbs, moving slowly. Keep the same motion, move the thumbs into the palms of the hand, working from the middle, inside of the palm, slowly to the edges. Repeat slowly for about 30 seconds. Turn the hand over and very, very gently across the top of the hand, use your thumbs to push from between the knuckles and the bottom of the fingers to the wrist. This is very relaxing, but too much pressure can be painful. Hold one finger at a time. Hold it as if to wring the finger off the hand and give it a very gentle, slow side-to-side twist so that the knuckle bone joint is being rotated. There should be no cracking noises made on purpose, although it might happen. Slide your hand up so that you now can do the same to the second joint. Repeat gentle rotating of the joint and again onto the top joint of the finger. Gently give the hand a last squeeze, pat off the oil with a towel, and do the same on the left hand. Stimulate hand zones by applying pressure in circular motion from 3 to 5 seconds clockwise, then counterclockwise on each reflex point. You reflex the points on the entire hand. The colon This is the lung reflex on the hand. The colon and large intestine reflex on the hand is located here. The heart reflex, small intestine, the hand and liver reflex, the palm of the hand. For this step, have the right hand lying flat on the table or soft surface, palms facing upward. Gently use the hand reflexology technique for each of the steps below. First, you begin at the soft padding under the fingers, moving downward over the area, then upward, then sideways. Follow the same pattern as above for the center of the palm. Use the same technique and pattern. Do the other outer edge of the hand downward from under the little finger to just above the hard bone on the wrist. Using the same technique and pattern, do reflexology from the base of the thumb across to the outer edge of the hand. All of the soft padding between the palm and the wrist. This is a very important area and relates to many things, including your spine and digestive system. Lastly, very, very gently and softly rub the wrist from the left to the right once, then from the right to the left. To the back of the hand, turn the hand over so that it is palm facing down. Here you will be using the same hand reflexology technique, but much gentler. This is a very sensitive area and very gentle pressure is required. Frequently, ask the person receiving reflexology if they are okay with the amount of pressure applied. You want to walk down in one direction from the knuckles to the wrist until every part of the back of the hand has been done. And secondly, gently do reflexology around the wrist bone and along the wrist. And repeat all of these steps on the left hand. The benefits of foot and hand reflexology. It aids in the relief from stress and stress-related conditions. It helps with digestive disorders. Reflexology can relieve headaches and tension. Arthritis patients have experienced relief in regards to muscle tension. It helps with insomnia, hormonal imbalance, relief from sport injuries, premenstrual syndrome, relief from digestive problems such as constipation, backaches, and other kinds of muscle tension. Reflexology is definitely a popular complementary therapy, and it promotes relaxation in the body, improves blood circulation, reduces pains and aches, soothes tired feet and hands, and promotes overall healing. Reflexology is also used for post-op care and for people with cancer under doctor supervision. Reflexology is a recommended therapy and should not replace any kind of medical treatment. Ear reflexology. Next, we'll take a look at the ear and how it relates to reflexology. Ear reflexology is not as well known as foot or hand reflexology, but it's just as effective for relieving stress and pain. Application of ear reflexology is fast and easy, and it's ideal to use when other health conditions make the more traditional reflex therapies unsuitable because of cuts, scrapes, or other serious injuries. You want to consult with your ear reflexology chart to find the reflex points for any particular issue you are experiencing, so you can be sure to concentrate on those points during your session. A client can be in a sitting or in a reclining position during a session. You pull the client's hair back if it's long, or it will interfere with the ear reflexology. Secure it with a clip or a ponytail to keep it out of the way. You want to warm up the ears first and start with your earlobes of both ears. You want to squeeze the lobes lightly and pull them down. Just a gentle tug downward. Don't pull so hard you experience pain. You then trace the outer edge of your ears up and around, and you repeat this motion several times. While you're doing this, you can begin to identify sensitive areas on your ears, if any, and pay attention to any place on the ear that feels tender, sore, or painful when you press or squeeze it. Look at your ear reflexology chart if you aren't sure of the corresponding areas for a particular sore point. It isn't necessary to know the correlation, but it is interesting and enlightening for your client to know. For example, if your reflex point for your bladder is tender, you may be in the beginning stages of a bladder infection without even knowing it. You could then take preventative measures to head off the bladder infection. You begin at the top of your right ear and slowly work your thumb and forefinger along the outer edges, continuing to the end of your earlobe. Apply pressure on the outer edge of your ear by gently squeezing and releasing every point along the ear. For best results, repeat this procedure at least 5 times. Go slowly and hold the pressure for at least 5 seconds before inching down to the next spot. Then you repeat this process on your left ear. Work the inner crevices of your ear, since there are many reflex points there as well. A professional ear reflexologist usually uses a small, blunt stick to work those points because fingers are often too large to pinpoint a reflex area. Ear reflexology routine. You want to start with your earlobe of your right ear. Squeeze the lobe lightly and pull it down. Just a gentle tug downward so you don't pull so hard your client experiences pain. Trace the outer edge of your client's ears up and around and repeat this motion several times. Identify sensitive areas on your client's ears and ask for feedback. Pay attention to any place on your client's ear that feels tender, sore, or painful when you squeeze or press on it. Consult the ear reflexology chart if you aren't sure of the corresponding area for a particular sore point. Begin at the top of your right ear and slowly work your thumb and forefinger along the outer edges, continuing to the end of the earlobe. Apply pressure on the outer edge of your ear by gently squeezing and releasing every point along the ear. For best results, repeat this procedure several times. Go slowly and hold the pressure for 3 to 5 seconds before inching down to the next spot. Work the inner crevices of the ear and repeat this process on the left ear. Ear reflexology is beneficial in many ways, but the most notable is for the instant relief of pain. Chinese reflexologists have found it most beneficial for treating infections, lowering blood pressure, and balancing hormones. As easy as ear reflexology is to administer, it's just as easy to apply ear reflexology to your friends and family members. There are nerve endings all over your ears, so a thorough ear reflexology session stimulates all of the other areas of the body. Unlike traditional foot and hand reflexology, where the foot and hand represent the left side of the body and the right side, the ear represents the whole body, so only one ear is worked on at a time. This slide will show you specific points for challenged areas and the points to work on for things like insomnia, stress eating, smoking, menstrual cramps, anxiety. The history of facial reflexology. Facial reflexology was developed in the 1980s, becoming a very therapeutic approach. The results are organic in a natural, physical, chemical, and neurological way. The original method was discovered in Vietnam by a team of doctors and acupuncturists at a hospital in Saigon in 1980. Professor Cho, his method includes elements based on acupuncture, Western medicine, neurology, and reflexology. Dr. Cho studied the relationship between the face and the body and found the face had more than 500 points to stimulate, which only has 30 acupuncture points of stimulation. Your MAP points relationship with the central nervous system and the cerebral cortex, causing the ability to obtain fast and effective results. Treatments are applied in different conditions such as muscle contractions and joint inflammation, stiff neck, knee problems, tendinitis, arthritis, headaches, back and neck pain, sciatica, stomach ulcers, circulatory disorders, etc. The benefits of facial reflexology is that it can stimulate the reflex points of the face in any place and at any time of day to stop a cold, any type of fatigue, or pain. There's no need to remove your shoes or clothing, only your eyeglasses. Its effectiveness is instantaneous, and the results are visible immediately, as it is both curative and preventative. Another advantage of facial reflexology is that at regular stimulation reflex face points, you can improve circulation and remove wrinkling. A relaxed face looks rejuvenated naturally. We see that facial reflexology allows you to treat health and beauty simultaneously. It's useful for medical and paramedical professions, by nurses, doctors, physiotherapists, osteopaths, beauticians, to name a few, allowing pain relief within minutes by relaxing the nervous system, re-energizing, stimulating the immune and biological functions of the body. To ensure the person receiving face reflexology is sitting comfortably, their shoulders and head must be supported. Generally, the best place to position yourself when doing face reflexology is behind the person receiving it. If they are in a chair, you're standing behind them. If they're lying down, you stand next to their head. We recommend never standing in front of a person because they'll be unable to relax with your body physically looming over them. A typical face reflexology session lasts about 15 minutes and uses gentle, firm pressure applied to a point in a circular motion for about a minute. You want to stimulate each face reflex one at a time, unless they're where there are 2 points on the face for the same organ or area. You use light pressure, about 1 pound of pressure, and if you want to work a specific area of your body, Like, for example, the chest area to help when you have a cough, you'll do so as follows. The thyroid gland, you would gently rub up either side of the gland. For the bowels, the indent in the chin is good for constipation or for dull facial skin. The pancreas area, gently rub from underneath the lower lip to the edge of the lower lip. For the lungs, either side of the mouth. For the spleen, either side of the ridges under the nose. For the stomach, it would be the tip of the nose. For the liver and the lymphatic system, the deepest pit of the cheek, jaw and cheek joint. For the digestive process, you would gently press along the ridge of the cheekbone. For facial skin and for the colon, you would tap gently under the eyes, starting on the outside, moving in. For the kidneys, you would tap gently under the eyes, starting on the outside, moving in. For the pituitary gland and reproductive system, this area would help with perception and imagination. For mental alertness, the edge of the forehead helps improve thinking capacity. For the nervous system, the center point of the forehead. And for the ears, pinch up and down ears with the forefinger and thumb, which helps the whole body. And for the sex glands, massage the ridge of the jaw, beginning at the ear and go to the chin. A relaxation exercise with facial reflexology. Here's a simple exercise you can practice when you wake up or during any time of the day you need to relax, and it only takes a few minutes. Start rubbing your hands vigorously together to provide warmth. Then put your palms of your hands on the face, on each side of the nose, fingers upward. With gentle pressure, raise your hands along the central axis to the roots of the hair, and then get your hands on either side of the face to the jaw and the chin. Repeat the movement several times. This exercise relaxes, activates blood circulation, and activates energy in the body. Additional assistance with foot, hand, ear, and face reflexology. It can help for things such as anorexia, arthritis, bedwetting, colds, constipation, cough, dizziness, diarrhea, eating disorders, eye disorders, flatulence, goiter, headache, hyperactivity, indigestion, insomnia, loss of voice, menstrual disorders, mental tension, migraine, nose disorders, painful joints, sinusitis, sore throat, thyroid disorders, tonsillitis, and toothache. Is there a governing body that oversees or credentials practitioners of reflexology? Only 2 states, North Dakota and Tennessee, currently license reflexologists. The American Commission for the Accreditation of Reflexology Education and Training, the ACARET, sets the standards for education required for reflexology profession. It also credentials those involved with the educating students of reflexology. The American Reflexology Certification Board, the ARCB, has a 3-part examination process to ensure the practitioners have met the standards set by the board. In order to be certified through the ARCB, a minimum of 110 hands-on training hours must be completed. To remain certified by the ARCB, an annual fee is collected and 12 hours of continuing education every 2 years must be documented. This certification is voluntary and not mandatory to practice reflexology. However, certification is not a license to practice. Cities and states have distinct requirements and regulatory agency for practicing reflexologies. So you want to make sure you are in compliance with existing regulation. Other modalities complementary to reflexology. Reflexology, acupressure, Qinei Tsung, acupuncture, and massage have common origins and modalities. They all use the concept of stimulating pressure points in various locations of the body to relieve stress and/or stimulate the body's natural healing process. These points can be the actual locations of discomfort, may be associated with meridians or energy lines through the body, or may be projections of the other anatomical parts of the body on the ear, hand, face, or foot. Acupressure and acupuncture. Acupuncture and acupressure. Reflexology is similar to acupuncture and acupressure in that it works with the body's vital energy through the stimulation of points on the body. However, acupuncture and acupressure points do not always coincide with reflex points and channel zones used in reflexology. Reflexology and acupressure are both reflex therapies in that they work with points on one part of the body to affect another part of the body. While reflexology uses reflexes along the 10 zones that are in an orderly arrangement resembling the shape of the human body on the feet, hands, face, and outer ears, acupressure uses over 800 points that are found along thin energy lines called meridians that run the length of the entire body. Reflexology and massage. There are a number of workshops and schools offering reflexology as part of the curriculum. A typical beginning level reflexology course consists of 15 to 30 hours of hands-on class time, including lecture, demonstration, and hands-on practice. Massage schools are now teaching reflexology as one of the techniques a practitioner can learn, but it is important to recognize that massage therapists have a different orientation than a reflexologist. A massage therapist is focused on maintaining and manipulating the soft tissue and soft tissue manipulation techniques, and many times that do not apply to the feet. A reflexologist applies pressure to reflex points and by an internal mechanism not directly related to the manipulation of tissues that creates relaxation and releases tension. Massage therapists also spend a small percentage of their study on reflexology, typically 2 to 3 weeks, whereas a student of reflexology spends 100% of his or her time on a longer course studying the art and science of just reflexology. Massage therapists work from the outside in, manipulating specific muscle groups or fascia to release tension. Reflexology practitioners see themselves as working from the inside out, stimulating the nervous system to release tension. Another difference between massage and reflexology is that a client will stay fully clothed for a reflexology session, except for removing footwear, whereas clients remove clothing for a massage session. Reflexology and Qinei Tsung. Both reflexology and Qinei Tsung work on the outside to benefit the internal organs and systems on the inside. While reflexology is used on the face, ear, foot, and hand, Qinei Song primarily works on the navel region of the body. Qinei Song comes from classical Chinese medicine and uses the 5 elements, the qi, and the breath and body meridians for organ points around the navel for balancing, healing, and relaxation. Reflexology self-care. As we discussed earlier in the presentation, self-care is something very essential and important to take care of yourself in the bodywork field. You need to be in good shape so you're able to help your clients. It's possible for you to start a self-treatment reflexology program, and it's as simple as going barefoot on the grass. Some of the important reflex points along with the areas they stimulate are mentioned below, which I'll read to you. These reflex points are found on the foot and are easily reached by yourself. The tip of the toes are related to the head. The reflex points on the ball of the foot are connected to the chest and heart. And you'll find the reflex points of the intestines and lower back on the heel of the foot. The reflex points of the pancreas, liver, and kidney are found on the arch of the foot. By massaging these points, one can improve the healing of all the organs mentioned. They've been really effective in passing the energy of these reflex points to the organs they're associated with. Begin your reflexing and relaxing 10 minutes of hand reflexology treatment by pinching the tips of each finger and thumb of your right hand. Reverse and repeat this process for your left hand. The pressure applied to your finger should be firm but not painful. A few seconds for each finger will do. Reflexology tools. Health food stores, or online natural healing stores sell various kinds of foot rollers, hand rollers, and perhaps rubber, wooden, or metal balls, blocks, and other devices to help with your reflexology sessions. Some people rub their feet with a tennis ball. For example, a foot roller can be wonderful for self-care to use when you're just sitting at your desk or watching TV or using a computer. It can be placed under your foot and you just roll your foot over it. This will not work well for a reflexology session, but it will work for a spot treatment specifically for self-treatment. Wooden tools are preferably safer than metal ones, and sometimes a tool can help you probe in areas of a foot that are harder to reach, though I personally find fingers are just fine. Tools are also good for people whose hands and fingers may not be as strong enough to do a thorough job. Drink water after self-care and advise your clients after their reflexology session. Water is important because an increase in blood circulation means the body will get rid of waste easier. Your reflexology sessions will be more successful if you follow these 2 steps, whether it's for self-care or a session with a client. Get the person receiving reflexology a big glass of water. Tell them to take it easy for the rest of the day and keep up drinking water after their session. Here are some resources used for this presentation. And congratulations! Now that you've finished this presentation, you must complete the final exam that was sent by attachment. Make sure your name and license number are on the bottom of the exam, the way you want it printed on your e-certificate. Email the completed exam to kajini.d@gmail.com. To satisfy your reflexology online class requirement, you must achieve a score of 70% or higher. An e-certificate will be emailed to you at the email address you provided upon registration. If you have any additional questions, please contact me at kajini.d@gmail.com. You might also want to check out some of these other NCBTMB approved continuing ed distant learning classes for massage therapy. We have acupressure, aromatherapy, ethics, growing your bodywork practice, nutrition, planning for the luxury destination spa interview, sports massage, whole body cleansing, and 2 that are not approved but very valuable to watch for those in states that don't require NCBTMB approval, understanding chakras, and improving your eyesight with Qigong. Payment is handled directly through PayPal, and once you've registered and paid, you'll be taken to the class. Listen to the class as many times as you like and complete the exam and return it via email. When you receive a passing grade of 70%, you'll receive an e-certificate of achievement via email. And again, if you have any additional questions, please email us at bewell@gmail.com. Beacon Wellness Arts is approved by the NCBTMB as a continuing education provider, number 450919-09, and is also sponsored by the NCBTMB to teach New York, Florida State Board of Massage Therapy, number 5014392 with CE Broker, Texas, Oregon, Washington State, New Jersey, Pennsylvania, Illinois, North Carolina, licensed massage therapist continuing education, as well as 20 other states that require NCBTMB continuing ed approval. The end. May you go peacefully in the Tao.